From that first point, you slide in about half a centimetre or so towards the spine and apply pressure again. Finally slide up about another half a centimetre and you're back into the occipital region again. And all those 3 points are very good for headaches and tension in the neck. Those are repeated 3 times and we repeat this move to the other side of the neck. Having done that, the neck and shoulder relaxation is completed and we're now ready to release the hair and begin the scalp work. And so to begin the scalp work, we're going to work a pathway which begins just above the client's ear. We're going to move forward to the temple and then we're going to work diagonally over the dome of the head, just down to the base of the skull where it meets the top of the neck, and we come forward in a straight line. If you think about it, it's actually a Z on its side. Let me show you that again. Just from above the ear, forward to the temple, over the dome of the head, to the bottom of the skull, and forward in a straight line. What we're actually doing here is tracing meridian lines as we work. And so the first move is with the letter C. So we position our hand as if it was a letter C. And we're going to use this side of the hand. When you're working on the scalp, rather than have the hand here, move it to the side of the head and support as you're working. When you're performing this move, make sure that you have your hand in a letter C shape. This would be an incorrect way of performing the move, and clenching the fist will also be incorrect as well. This puts too much pressure on the head, so just a nice scrubbing action. So to begin, we start above the ear and we circle towards the temple, releasing the hair if it starts to get caught. We circle over the scalp. This is called scrubbing. Notice I'm working over the dome of the head, down, to the bottom of the skull, forward in a straight line. And again, I'm going to go back to the starting position, forward, Sometimes at this point of the routine, the client's head starts to fall forward as they become more relaxed. So sometimes you might find yourself just holding the head or supporting it a little bit more as you perform the move. Now we're going to repeat this to the other side. So here you would place your hand on this side of the head to support it, and with your right hand, perform the move again. For number 2 on the scalp routine, we're going to work the same pathway again. This time we're not going to use the side of our hand, we're going to use our fingertips. So again, beginning above the ear, circling towards the temple. Still being careful not to pull long hair. Work the same pathway over the head. repeat to the other side. So from number 3 onwards, we need to consider one very important contraindication here, and that's epilepsy, or any clients who have a history of seizures. Theoretically, because the brain lies beneath the skull, any striking or tapping movements we perform on the head could overstimulate the brain tissue. And so, just to reassure you, it's perfectly fine to scrub, perform moves 1 and 2, but some of these moves will have to be omitted for clients with epilepsy. This is one such movement that we're going to perform now that should be omitted, and it's called pecking and plucking. And so, working for around 30 seconds all over the scalp, we're going to perform these pecking movements on the scalp. Remember to move around the scalp, don't stay in one position, work around the back of the head, and the side of the head. You can see the hair coming up and hear that scraping noise on the scalp. This is very good for stimulating the hair's natural oils, the sebum in the skin, but also for relieving scalp tension, which is one of the problems that people have when they suffer with headaches and migraines. The skin and the muscles around the scalp become very, very tight, causing pain. So this is very good for relieving the tension. And the next move is also very good for the same. This is called upwards flicking. We're going to use the side of our hand here, side of our fingers basically, and it's almost like we're flicking the hair up, just gently brushing the scalp with our hands. So the move looks like this. You can see the hair as it flies up, around the head again. This move again is performed for around 30 seconds. Just to remind you, don't perform this move if your client has a history of seizures or epilepsy. We're going to perform another head brush now. You've performed this move before, back in the neck and shoulder routine. So just to remind you, you're going to sweep across the dome of the head, not over the ears, and either along the shoulders and off the arms, or the alternative is to sweep down either side of the spine, over the scapula, and the third time over the shoulders and the arms. And so now, some more tapotement moves. We're still striking the scalp here, or stimulating, so again this is contraindicated for epilepsy. Using the pads of the fingers together, tap all over the scalp. This feels very, very stimulating. The scalp starts to tingle and blood starts to flow into the area, so very good for people who have thinning hair, or maybe lost their hair through alopecia, providing it's not alopecia from chemotherapy treatment. So again, working all over the scalp. And then you can vary this sensation by performing raindrops. Again, all over the dome of the head, around 30 seconds. And the faster you drum, the more stimulating it becomes for your client. Then we're going to perform hacking. Now, hacking is something that's performed in body massage. It's known as a tapotement move. There's a very particular way that you should perform hacking, and to perform properly, you should ensure that firstly the wrists are very relaxed, as are the fingers. The fingers should be straight, not curved. So everything is relaxed. And imagine that the scalp is very hot, so as you touch the scalp, you pull your hands away very quickly. When you're hacking properly, you hear this sound as the fingers are hitting together. And that's the noise you should be hearing when you're performing this move. When you're hacking on the body, you can use the whole of the side of the finger and the hand. Because we're hacking on the head, very importantly, only let the small part of your little finger come into contact with the scalp. Very often people are alarmed this move because it sounds as though it's painful, but actually it isn't as bad as it sounds, and it's very, very stimulating. So here we go. So for around 30 seconds, the last two moves we're going to perform now, and firstly we're going to do some hair tugging and pulling. This is an essential part of Indian head massage, and in India this is performed with quite a lot of pressure. You can vary the pressure around here just by checking with your client. If they have very sensitive scalp, they may not like the hair to be tugged too much. You can perform the move with both hands together, or if your client prefers less pressure, just one side at a time. Making sure that you don't pull the hair from the hair shaft, but by scrunching your hands, you pull from the root. Often as you perform this move, you sometimes feel that the hair's own natural oils have been released from the scalp, and you feel the oil on your fingers. This is a good sign. It means that the natural oils that are being released are promoting hair growth. And to finish off the scalp section, we perform a move called combing and raking. Using the fingers as a comb or a rake, work through the hair, across the scalp, also this moves the hair back away from the face and the forehead. Throughout the hair part of the treatment, often the hair falls forward onto the face, so this is a way of kind of rearranging the hair back to how it was before the treatment began. And so that completes the scalp part of the routine, and we're now ready to finish the treatment with the facial acupressure. And so now we're coming to work on the face to complete the treatment. Very importantly, I use a bolster behind the client's neck when I'm working on the face. This is to stop the head falling back too far, which can be quite uncomfortable for the client. Also, it can provide a barrier as well. So placing the bolster in the back of the neck, just moving the head back so that it's upright, there's no strain on any of the neck muscles. We're ready to begin. We're going to work some acupressure points from medial eyebrow up to the hairline, back and around the contours of the face. So I usually cradle the head and use either my middle or my first finger, starting at medial eyebrow. Just gently press in and release before moving up. Press and release. Press and release. All the way up to the hairline. This is the kind of speed that you want to work at. Don't rush this move. I'm now working all the way back down again. Back to medial eyebrow where we began. And then along to the lateral part of the eyebrow. If you can't see over the top of your client's head, you'll know if you're in the right position because you'll feel the hair from the brow. So coming down, just along the top of the cheekbones, or the zygomatic bone. We're going to work just along the edge of the cheekbones, towards the sinuses at the side of the nose, and then brought down just to the side of the nostrils. And we're going to work back towards the ear, just underneath the cheekbones. Try to keep your hands level both sides. jawline towards the centre of the chin. I then work back along the jawline towards the ear, ready for the next move, which is ear massage. So when you get back toward the ear, take hold of the earlobes. Give a gentle pull and a stretch on the earlobes. And then nice gentle pulling and stretching around the edge of the ear towards the top. Give a little stretch at the top of the ear as well. And then back down to the lobe. Repeat this again. We're going to perform this move 3 times. Again, don't rush this part of the routine. Careful of any hair that gets caught. Of course, make sure your client has taken out their earrings or studs, if possible, before the treatment begins. And then using your fingertips, you're going to massage behind the ears, just around the mastoid area. Now we're going to perform the prayer position. So placing your hands in the prayer position underneath the chin, we sweep up the sides of the face, making sure the hand comes into contact with every part of the face. And then turning our hands, lock our fingers and slide out across the forehead. Again, this is performed 3 times. Of course, do alternate hands if you prefer when you're performing this move. And now we're going to cup. We're going to cup our hand over the third eye. The other hand is going to cup under the chin. I like to hold this position for however long feels appropriate. If you're a Reiki practitioner, what you usually find at this point is that you're channeling Reiki energy. Make sure you don't place your hands over the eyes. Clients often report that they see colours when you're performing these energy moves at the end of the treatment. It isn't uncommon for this to happen, although it doesn't always happen. And because we're working with energy, we slowly move our hands to the next position, which is to cup over the ears. Again, don't press on the ears, just lightly cupping over. Thumbs just resting on the temple. And again, hold that position for a few moments. Lastly, I'm going to cup very gently over the eyes. Don't place any pressure on the eyes at all. Be very careful about pressure with your fingers on the eyeball. So just have your fingers just a centimetre or so away. Also, people who are claustrophobic don't like to be have the hands placed too tightly over their eyes. very gently, staying in contact. I'm going to remove the towel from behind the neck, placing it in between my legs. I'm going to do one more head brush. Again, I'll show you both options. Firstly, the one that slides down off of the shoulders, or down the back, across the scapula, and across the shoulders. And so to ground your client, you can either place your hands directly on the shoulders very lightly, as we began the treatment. A nice way to finish the treatment is to unravel the towel, place it over your client's shoulders as you perform grounding moves. So I'm asking your client to take 3 deep breaths. It's advisable with your client just to allow them to sit there for a few moments, offer them a glass of water to help them come round. 2 things to bear in mind here. Firstly, if a client has existing low blood pressure, Indian head massage often lowers the blood pressure, so they could feel slightly lightheaded. Might be an idea just to let them sit and relax, just to let the blood pressure stabilise a little bit. Another thing to be mindful of is a client with diabetes. They're not totally contraindicated for Indian head massage, but massage of all forms can sometimes mean that insulin, if a client takes insulin artificially, is absorbed a lot quicker. And so one of the things to be mindful of is slightly low blood sugar level. If I know a client has diabetes, what I often ask them to do is to take their blood sugar level at the end of the treatment, just so that we can be sure it hasn't fallen throughout the massage. Again, just check the client hasn't shown any signs of hypoglycemia, like sort of sweating, clammy skin or anything like that. So 2 things to bear in mind as well is low blood pressure and diabetes. If the client's okay, I'm going to offer them a glass of water to complete the treatment.